due to the recent COVID-19 cluster. The Ministry of Health is implementing measures to halt the possible spread of the virus at all major medical facilities. Persons entering the hospital grounds will be stopped at the security checkpoint at the front entrance for preliminary screening before being allowed into the compound. Director of Medical Services Dr. Taisha Donald says protocols are also being put in place for persons visiting the Emergency and Accidents Department.
So whereas traditionally we would have been having a lot of persons coming with conditions that could have been seen by the physician at the clinic or the private physician, a lot of persons will come into A&E for that purpose. So for accidents and emergency, the protocol now is this. One, persons coming to accident and emergency must come, once they're 18 and over, they need to come by themselves, except that they need assistance. So persons who are, with a disability or, challenged in some way that would need assistance, they are allowed to have one person with them.
Persons who are admitted in the hospital are allowed to one visitor per day. Items can be dropped off for patients between 7 and 9 in the morning, and these will be delivered by administrative staff. Children will not be allowed on the compound except they are admitted for treatment or follow-up care. Director of Hospital Services Dr. Coral McIntosh has made it clear that only 6 visitors will be allowed on a ward at any given time.
Seeing here that no more than 6 visitors
for the entire ward. Right. So it allows for, because in a cubicle, because each ward has 24 patients, and we cannot afford to have all 24 have someone with them because they're in the cubicles where you have at least 6 to 8 patients in beds. And so if you have someone sitting next to a bed, you already have less than that social distancing. So we have like 3 per cubicle maximum. And then to allow for the fact of us controlling the traffic, we have less than all of that to allow for people to come and go. So be cognizant when you come in for your visit. Please do not try to stay for the entire visiting hour because someone else is waiting.
No loitering will be allowed at the outpatient clinic. Patients will only be allowed in the area 15 minutes before their appointed time. For GBN News, I am Rena Pett Thomas reporting.